Morning sickness relief with these 5 simple tricks. Waking up to the spin cycle before you've even had your first sip of water? If you're one of the 70 to 85% of pregnant women whose mornings, and often afternoons, are hijacked by nausea, trust me, you're not alone. It's tough, draining, and honestly can feel like a cruel joke. But what if I told you there are genuinely effective, doctor-approved ways to reclaim your day? In the next few minutes, I'm handing you 5 simple, natural tricks that can turn that all-day nightmare into a mere hiccup. No bizarre ingredients, just real relief. Trick 1, Vitamin B6 Boost. First up, meet vitamin B6. OB units call it the morning sickness MVP for a reason. Just 30 milligrams a day, often in your prenatal, can significantly calm that relentless queasiness without any risk to baby. It's cheap, over-the-counter, and tastes like nothing. Swallow it with a cracker and you're done. For more severe nausea, chat with your doctor. A prescription combining B6 with doxylamine can slash nausea and vomiting by up to 70%. It's a game changer, safely used for decades. Don't underestimate humble B6. Trick 2, ginger on repeat. Next, let's talk about an old friend with serious scientific backing, ginger. Not just for cookies anymore. This spicy root is a natural wonder for soothing an upset stomach. Around 750 milligrams of powdered ginger daily, roughly a quarter teaspoon or a strong cup of ginger tea, can significantly reduce both nausea and vomiting within days. Ginger is versatile. Candies, capsules, lollipops, even real ginger ale. Find the form you'll use consistently. Just keep daily intake under 1.5 grams to avoid heartburn. It's a gentle, effective way to get relief. Trick 3, graze, don't gorge. Here's a trick that sounds almost too simple. Graze, don't gorge. An empty stomach is a nauseous stomach, and so is an overly full one. The fix? Eat like a toddler. Small, frequent, often. 6 mini meals of bland carbs, crackers, rice, bananas, toast, or oatmeal keep blood sugar steady and gastric acid busy. For fluids, sip constantly, but here's a key. Separate them from solids by about 20 minutes. This prevents that uncomfortable sloshing sensation. Think sips, not gulps, and consider clear broths or peppermint tea. It's a gentle, effective way to get relief. Trick 4, press the P6 point. All right, let's get hands-on with trick number 4, acupressure, specifically targeting the P6 point. This isn't some ancient secret, it's a clinically recognized spot that can seriously calm your stomach. To find it, place 3 fingers from your opposite hand, starting at your wrist crease, where your index finger lands right in the middle of your forearm between those 2 prominent tendons. That's your P6. Apply firm, steady pressure with your thumb for about 30 seconds, then switch wrists. Studies show it can make a real difference, cutting down on dry heaves and general queasiness. A free, drug-free way to find relief, right at your fingertips. Use it discreetly, anytime, anywhere. Finally, for our 5th trick, let's talk about hacking your senses. Pregnancy super smell is real, turning normal odors into instant nausea triggers. Microwaved fish, instant gag. So take control. Keep rooms cool, windows cracked, and trash emptied constantly. When cooking, swap strong spices for mild herbs. For unavoidable smells, carry a lemon wedge, peppermint oil on cotton, or fresh mint. A quick sniff can reset your senses. Pair this with 10 slow breaths, in through your nose, out through your mouth. This isn't just relaxation. You're stimulating your vagus nerve, calming everything from the inside out. It's amazing how much control you can regain. Soft mid-roll. Feeling a glimmer of hope already? I truly hope so. If any of these tricks offered you relief, please share your experience. Drop a yes or tell us which one worked best in the comments below. Your story could be the lifeline another mom-to-be desperately needs. Let's build a community of support. When to level up to meds. Now, sometimes your body needs more backup, and that's perfectly okay. If you're finding it impossible to keep any food or water down for 24 hours, if you're losing weight or just feel utterly miserable, it's time to call your healthcare provider. Seriously, don't hesitate. These can be signs of hyperemesis gravidarum needing medical attention. The good news, safe, effective prescription options exist. Your doctor's first go-to will likely be that B6 and doxylamine combo, FDA approved, non-addictive, and backed by decades of safety research. Other medications exist, but your doctor is the best to tailor a plan. You don't have to suffer in silence. So let's quickly recap your new morning sickness survival toolkit. Pop your B6, sip soothing ginger, graze like it's your full-time job, press that P6 acupressure point, and keep your world lemony fresh. Stack these 5 simple tricks and most women find significant relief within a week. While it feels like forever, remember, morning sickness usually fades around week 14. This isn't a life sentence, it's a temporary challenge, and you've got the tools to tackle it. You are strong, resilient, and you've got this. If you know another pregnant friend who's hugging the toilet, please share this video. She'll thank you between crackers. And for more real-life pregnancy hacks, hit that subscribe button. You're not alone.